Seasonal affective disorder, also known as SAD, is a type of depression that comes and goes in a seasonal pattern, and it's sometimes known as winter depression because the symptoms are usually more severe during the winter months, but this isn't always the case. Now, common symptoms can include things like a persistent low mood, a loss of interest in normal activities and everyday activities, feelings of despair, or feeling really tired and sleepy during the day, as well as potentially finding it hard to get up in the morning. Now, for some people, these can actually be really severe symptoms, and if this is the case for you, then you should speak to your health provider. Now, the exact cause of seasonal affective disorder, which I'll refer to as SAD in this video, isn't fully understood, but it's often linked to reduced exposure to sunlight during the shorter autumn and winter days. And the main theory is that a lack of sunlight might stop a part of the brain called the hypothalamus from working properly, and this in turn affects the production of various important hormones like melatonin and serotonin, as well as your body's internal clock. Now, in this video, we're going to cover treatments that are available for SAD, and this is going to be a general overview of treatments, and they can include simple things that you can try at home, as well as things that you will need to speak to your doctor about. Now, your own health provider is going to recommend the most suitable treatment option for you based on the nature as well as the severity of your symptoms. And it might be a combination of treatments to get the best results instead of just one of them by itself. So let's start off with some things that you can try at home, because the good news is there are a number of things that you can do to help improve your symptoms yourself. Firstly, I would recommend that you try get as much natural sunlight as possible. Now, I know this can be really difficult in Northern European winters, but even stepping away from your desk at lunch and going outside can be really helpful, even if this is for 5 or 10 minutes a day. Second, try to make your work and home environments as light and as airy as possible. Try to sit near windows that you get some natural light during the day when you're working at your desk. Now, some people like to use SAD lamps or light boxes. Now, these can work for people, but the evidence is slightly limited. My advice is that there is no harm in trying them, and we'll cover more details about them later on in this video, but they may not necessarily work for you. Third, take plenty of regular exercise, particularly outside and in daylight if you can. And this is really important because exercise can help with low mood and depression, and also because being outside will expose you to more natural light. Fourthly, now this might be hard to do because you might not want to do it, but try to eat a healthy and balanced diet. And finally, try to think of ways to manage your stress. This is going to be different for everyone, but you could consider trying out swimming, yoga, or meditation, and there'll likely be some local classes that you can try out and see what works for you. I personally recommend that it's also important for you to talk to your family and friends about seasonal affective disorder so that they understand how your mood changes during the winter, and this can help them to support you more effectively. And it also means that you might feel less alone during this difficult time. So now we've covered some simple but effective things that you can try out by yourself at home, let's talk about talking therapies, which focus on how your brain works as well as how you interact with others. Now, the first is cognitive behavioral therapy, or CBT, which is a talking therapy based on the idea that the way we think and behave affects the way we feel. Now, changing the way you think about situations and what you do about them can potentially help you to feel better. Now, CBT involves several sessions with a specially trained therapist, usually over several weeks or months. Now, your program could be done by yourself, with your partner, especially if it's affecting your relationship with them, or in a group with people who are in a similar situation. You can also choose to do it face-to-face, so in person, or you might be more comfortable doing it online. Now, whichever option you choose, there are lots of different solutions, and it's well worth trying. Now, the second type of talking therapy that can be effective for SAD is counselling and psychodynamic psychotherapy. Now, this involves talking to a trained counsellor about your worries and problems, and you might discuss how you feel about yourself and others and talk about experiences in your past. Now, the aim of the sessions is to find out whether anything in your past is affecting how you feel today. Now, I've also included lots more useful links in the description box of this video, including more information on talking therapies, which go into more detail about them, as well as information on where you can potentially find a therapist to help you with this. So now that you're aware of the talking therapy options, let's move on and discuss medications. Antidepressants are often prescribed to treat depression, and they're also sometimes used to treat severe cases of SAD, although the evidence to suggest that they're effective in treating SAD is slightly limited. Now, antidepressants are thought to be most effective if they're taken at the start of winter before your symptoms appear, and then continued through until spring. Now, selective serotonin reuptake inhibitors, also known as SSRIs, are the preferred type of antidepressant medicines for treating SAD, and they work by increasing the level of serotonin in your brain, which can help to lift your mood. Now, before taking antidepressants, it's important to have an open and honest discussion with your doctor about how long they might take to work, as well as possible side effects. But it's important to be aware that they can take up to 4 to 6 weeks for the medicine to take full effect, and you should never stop taking the medicine suddenly. Instead, if you are thinking about stopping taking the medicine, it's best to have a planned discussion with your doctor. Now, it is possible to get side effects from antidepressant medication. This can include feeling agitated, shaky or anxious, as well as having an upset stomach or diarrhea or constipation. But typically these symptoms should improve after a few weeks. It's also really important to read the full list of side effects that will be in the information leaflet inside the medicine box. And if you're not sure about it, you can speak to your health provider to talk through any of your concerns or worries before starting to take them. Now, the final treatment option that we're going to talk about is something that I mentioned earlier in this video, which is light therapy, which some people feel really improves their mood considerably. Now, this involves sitting by a special lamp called a light box, usually for around 30 minutes to an hour each morning. Now, they can come in a variety of designs and sizes, but typically they produce a very bright light, and the thinking behind this is to stimulate the same bright light that you might get in the summer months from the sun. Now, the underlying theory behind the light box is that the bright light should reduce the production of melatonin, which is the hormone that makes you feel sleepy, and then on the other hand, increase the production of serotonin, which is the hormone that affects your positive mood. Now, some people also try sunrise alarm clocks, which gradually light up the bedroom as you wake up. This is an alternative option to a light box. Now, most people can use light therapy safely, but it's important to choose a light box that is made from a fully certified manufacturer and that is medically approved. Light boxes typically have filters that remove harmful UV rays, so there's typically no risk of skin or eye damage for most people. But if you've got an eye condition that makes you sensitive to very bright lights, or if you're taking a medication that increases your sensitivity to light, then it's best to speak to your health provider first before using one of them. Now, if you go ahead and decide to purchase one and try it out, make sure you read the information leaflet fully, because this is going to let you know the intensity of light that you should use, as well as how long you should be using it for each day. Now, according to the NHS website, there is mixed evidence regarding the overall effectiveness of light therapy, but some studies have concluded that it's effective, particularly if it's used first thing in the morning. It's also thought that light therapy is best for producing short-term results. This means that each winter you'll need to use it, but most people notice some difference within a week of starting to use a light box. Now, there can be some mild side effects from using light therapy, like headaches and eye strain because of the bright light, but usually, like I mentioned, this is mild as well as short-lived. So in summary, there are 4 main treatments for SAD. First of all, things that you can try at home, things like getting outside where possible, sitting next to a window, talking therapies, so things like CBT, as well as medications like antidepressants, and finally, light therapy. Now, I would recommend that you can try one or a combination of these things, and it's about finding out what works for you. Now, I hope you found this video helpful and informative. Please do check out the description box for lots more useful resources, and please consider leaving a comment if you enjoyed the video and sharing it with a friend or family member who you think might benefit from this. Once again, thanks for watching, and until next time, bye.